Hi guys, welcome back to my channel. If you're new, welcome. My name is Arielle. I post videos relating to Crohn's disease and ankylosing spondylitis, which are two types of autoimmune diseases. And I also post videos relating to diet, lifestyle, medications that I use for those two conditions and how they help me in reducing my symptoms and making my life just better overall. And so this week I thought I would talk about patient advocacy and its importance. If you hear any noise in the background, like the gardener, lawn mowing, or airplanes, or any birds chirping or dogs barking, I thought it'd be a good idea to film outside, but after 5 minutes of sitting here, I was like, maybe I shouldn't do this. But anyways, it's a nice day and it's fine. Anyways, so today I thought I would film a video about patient advocacy. I think that advocacy is such a crucial role in becoming diagnosed and discovering, why you're feeling a certain way, why you have your certain symptoms. And so without further ado, I am going to share my 6 patient advocacy tips, and hopefully you can learn something from this and apply it to your own life and to your own health and achieve, ultimate health and reduce your symptoms. So I have my notepad with my tips on it, so if I'm looking down, you know what I'm doing. Sorry, before I jump into the video, I thought I would tell you really quickly a backstory of why I'm filming this video and why I think it's important. It took me about 2 years to officially get diagnosed with the 2 autoimmune diseases that I have, but I met with people and I talked to people who weren't diagnosed for like 17 years, and they had all their symptoms, all the pain, and they just could never get diagnosed. And so that's why I think patient advocacy is so important, because if you tell your doctor exactly what's going on and they know, like, they have the whole picture, you have a higher chance of getting diagnosed and finding out, what is the root of the problem. So and so without further ado, let's begin. So my first tip is to tell your doctor all the symptoms you're feeling. So even if you think it's like super random or doesn't really like match the other symptoms you have, just tell your doctor, because they might know something that you don't. So even if it's like a random eye twitch in the morning, every single morning, like whatever it is, just tell them, just to be sure that you're not missing anything, or like they know all the information, so it's not like a missing piece of the puzzle. And the second one is to articulate all your thoughts, symptoms, and questions, either like on a list or on your phone or whatever it is. So this is beneficial if you are a nervous person or if you're forgetful. If you have a list of all your thoughts and, like, let's say you accumulate your questions, your symptoms, your thoughts throughout the week, that way you don't like forget anything and you have everything in front of you, so you can just say, like, you can just honestly check it off as you read it off to the doctor, or even just show your doctor if you're too nervous. My third tip is very crucial. It's to go see a primary care physician, or to like go get a full-length appointment, not just like a quick, clinic or urgent care. In my experience, I had my symptoms for probably a little bit over a year. And for a year, at least every, 2 times a month, I would go see someone at urgent care, a doctor at urgent care. And, at urgent care, they want you to feel better and they want you to, get in and out. So I was prescribed like, just some steroids. I was told like, oh, your symptoms are gonna go away soon. They sound like a muscle strain. They didn't really know like the whole picture. They didn't take any like major tests. They didn't take my blood. They didn't do any x-rays or MRIs. And so I think going to a primary care physician or, like a full-length appointment would be in your benefit, because that way they can see like all the aspects, like how you're feeling, what your symptoms are. They can run lab tests on you. They can schedule you for MRIs or x-rays, and it's not just like a quick in and out. Okay, number 4 is to understand why your doctor is running certain tests and prescribing certain medications. So if you're ever unsure like what your doctor is doing or why they're making you go through like blood tests or prescribing you certain medications, I think it's really important to either ask your doctor or to do your own research, either like after the appointment or before the appointment, just so you know like what they're doing and why they're doing it, because it's your health. And I think it's really important to know, okay, why am I being prescribed like an immunosuppressant medication? Why am I being prescribed like an antibiotic? Whatever it is. Yeah, do your research and just, get a sense of what's going on with your own body. I think that's a really important way to make yourself feel a little bit better and understand, what's going on with your life, with your health. Okay, tip number 5. This was a turning point for me because every time I went to the doctor, I went in alone, or like to urgent care, I went in alone, and I kind of was like, I wasn't shy, but I just told them like what I was feeling, and whatever the doctor said, I would just be like, okay, like I'll do that. Like I just went home, was upset in my own head. I told my parents, I was like, I'm just really upset. They're not understanding like my symptoms. I feel like they're not like hearing me out. So this tip is to bring a friend, a sibling, a parent, or like a guardian, someone who knows your symptoms, how you're feeling, what you were before the disease, like before you had the symptoms. So if you have someone like that who can really like either speak on your behalf or like help make your case, I think that's a really beneficial tool for you, a good resource. That's bring a friend. That's number 5. And number 6, the last one, is to advocate for your own health and to remember why you're there. So it's kind of like public speaking, because you're talking to, a doctor, and it might be a little scary or intimidating. You might be a little nervous, but if you remember like the ultimate goal, so why you're there because you have symptoms, you have chronic pain, whatever it is, and think about the outcome that you want to achieve. I think it puts things into perspective for you, and at least for me, it gave me like a little bit more confidence to explain myself and to talk about my symptoms and taking claim of your life. And so you shouldn't be afraid of speaking up, asking questions, doing your own research, and I think that is how you will be more confident to reclaim your health and to feel better. So I hope this video helped. Let me know if you have any questions down below, and if you have any tips or suggestions or videos you want to see next, please let me know in the comments below. With that being said, I hope you guys have a great day. I hope you take care of yourself, wear a mask, be nice to other people, be nice to yourself, eat well, and thank you so much for watching this video. I can't believe we're already at so many subscribers. I feel so grateful for every single one of you. All your comments and all your subscriptions make me want to keep making videos and keep pushing myself. So thank you again, and I'll see you guys soon. Bye.